And thank you for staying with us here at 5. I'm Brian Abel.
And I'm Glenda Lewis, and we're going to begin this half hour with a health alert. If you're experiencing cold-like symptoms, there's a chance you may actually have COVID-19, and that's because several signs point toward a late summer surge here in the U.S.
Our chief health editor, Dr. Nandi, is joining us now. And Doc, what could be behind this possible wave? Could it be, maybe human behavior? Could it be variant? What is it? Maybe both?
And we're talking about this, right? There are many signs, Brian, that points to a COVID-19 summer surge. We don't want to hear about that, right? The CDC's recent data reveals an increase in hospitalizations, emergency room visits, and test positivity rates. Plus, the gene sequencing company Helix, which helps track changes in the virus, saw a 30 to 40% rise in cases since June. And the CDC is closely watching multiple COVID-19 variants that are co-circulating here in the U.S. These variants have genetic tweaks that make them slightly fitter and possibly more contagious. Having said that, the surge does not appear to be driven by any of these new variants. Instead, it's more likely that we're experiencing, as you suggested, a summer wave because immunity has waned. It's gone down, and the blazing summer heat has forced many of us to go indoors. Plus, more Americans are traveling, right, and therefore spending more time outside than their usual social circles.
Okay, so should we expect the numbers to go up? And then if they do keep on going up, how do we manage all of this?
The good news is that, that we see wastewater data suggests that this latest wave may actually be reaching a plateau. That's good news. Data shows that the virus is growing slower than just a few weeks back. Of course, that doesn't mean we'll have an immediate downturn. But in the past, usually we've seen cases decline after we've hit the plateau. So that's good news. Now, while this current surge may soon decline, it's super important to still decrease or curb the spread of this infection. We should all take preventative measures like getting tested promptly if you have cold symptoms. That's important. If you do test positive, please stay home to prevent further transmission. While COVID may just be a minor problem for some folks, there are still plenty of people developing severe COVID and also dying, especially the elderly and immunocompromised. So if anyone is at high risk of severe COVID, it would be a good idea still to wear a high-quality mask in public places. Additionally, I've been a supporter of vaccine. You guys know that, the whole time that we've had this. And this September, the new single-strain boosters targeting the XBB variant should become available. The CDC has not yet recommended, Brian, that these updated shots be given to specific groups as they're pending approval from the FDA. But as soon as these boosters are approved and available, I think it's a good idea to get vaccinated as soon as possible to increase your protection against COVID-19. We were talking about it. Both of us got vaccinated very early on in the last cycle. It's a long time.
It is a long time, so we're waiting for more guidance.
I think they'll get it pretty soon because it's good. It's about time.
All right. Dr. Nandi, grateful as always for your expertise.
My pleasure.
Thank you. If you have a health question for the doctor, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or Twitter. Glenda?